Maryland is 12 weeks into getting COVID-19 vaccine shots into arms. Now there's a game plan to better ensure fairness and equitable access to the vaccine, especially for underserved communities.
We are announcing the very first vaccine equity operations plan of any state in America to further address health disparities and the issue of equity, and to get more vaccines to people in every community who need them most.
The plan of action is the work of the governor's Vaccine Equity Task Force, which includes representatives from every jurisdiction around the state. The chair is Maryland National Guard Brigadier General Janine Burkhead.
Historic data shows that vulnerable, underserved, and hard-to-reach communities face both structural and informational barriers to vaccine access. Growing disparities in these communities make it necessary to be intentional and concrete in steps that we're going to take to remove these barriers and improve the rate of vaccine in arms in vulnerable populations.
The goal? To team up with local health departments, community and faith-based organizations to create community vaccination clinics in underserved areas.
And it's these community-centered models that will build confidence in vaccines and the vaccination process and provide more points of access for the COVID-19 vaccine as that supply increases and the number of people eligible for the vaccines increase as well.
Among the many factors that the task force will use to decide where to target its help, the minority composition of a community, the number of single-parent households, the size of the population over 65, and the number of households without access to vehicles. Just this week, the Baltimore City State Senate delegation sent the governor a letter citing what they called their grave concerns about the state's vaccine distribution strategy. Senator Corey McCray, chair of the delegation, says they want to make certain the task force builds on what's already in place.
There are people like Marvin Doc Cheatham that have been making sure that our seniors know where to go and how to get to it, and actually setting up hotlines themselves inside of the community to help our seniors with these issues. From a partnership standpoint, this is very, very important to make sure that we're not duplicating the mass efforts that are already out there.
We're not where we need to be with the Black community or the Hispanic community, and so we're continuing to take every effort to ramp that up.
Sue Copen for State Circle.